Hi, Dr. Keppel. I have a question regarding COPD. I know that I have a history of people in my family that smoke. Not all of them are dealing with any lung issues right now, but how do you support those who are currently smoking and probably won't stop smoking, and also those who have quit but they now have long term lung issues?
Well, I pretty much address both people the same way. And that is, I never tell a patient they should stop smoking because they've already been told by everybody else. They know they need to stop smoking. Coming to some chiropractor they just met for the first time, he tells them quit smoking. Oh, the light bulb goes on and they stop. No, that does not happen, okay? So I tell the smokers that they need to take Infoplex from Standard Process. Infoplex was designed for emphysema, which nobody has emphysema anymore because they have what?
COPD?
COPD, right? So we just renamed it. So Infoplex is a great multi-formulation to help the lung tissue. It's got pneumotrophin in it, and it's got calcium and Cataplex AC and different things to help the lungs kind of rejuvenate and heal. So with the smoker, that at least slows that process down. All smokers should take Infoplex forever. How many a day? 6 to 9 per day, okay? If they've stopped smoking, they should get on Infoplex to help rejuvenate that lung and those lungs over the long term. And they should stay on it, for life, okay? Now, the other thing about COPD and lung problems, and doctors way back when knew this, Francis Pottinger Jr. knew it, Dr. Lee knew it, is that there's an adrenal component as well. So Infoplex has adrenal support in there, but a lot of times these people need extra adrenal support because the adrenals dilate the blood vessels to the lungs. The vitamin for the lungs is vitamins A and C, so Cataplex AC, and the mineral is calcium lactate, okay? So now you throw in a little pneumotrophin and, there's pretty much a protocol. Infoplex has extra stuff in there. And so, yeah, I mean, that's all we can do. Now, if we can get them to stop smoking, we got to ask them, why are they smoking to begin with? Usually they're smoking to begin with because they're trying to medicate something. Tobacco's a tannin. It can dry out their lungs. Maybe, they want to be more dry. Also, tobacco has been laced with a lot of sugar. So a lot of times you fix the sugar cravings on folks and it's easier for them to stop smoking. But smoking is people will give up heroin before they give up their cigarettes. So that's how strong that addiction is. And that's why I don't get in the faces of the patients about it. But I say, at least if you're going to keep smoking, let's do some Infoplex. Now, MediEurope also has some great products to help the lungs, like BronchEffect for the bronchioles, Pulmico, Resco. And so some of these patients would benefit from some of those herbs as well that helps with tonification and rejuvenation. So that's how I handle those folks.
So the people who are trying to quit smoking, you mentioned, might need some additional adrenal support. Do you ever dip into like extra adrenaline or adrenal complex? Is that anything? Because I know the licorice in adrenal complex could be nice to just kind of suck on that. But have you ever experienced that? I'm just curious.
Yeah, I mean, for sure, the adrenals being a big time player in that are involved. I like the adrenal complex. I like the adrenal tonic because it's also got some echinacea in there and it's got a nice flavor to it. So I would really promote using that. And as far as the adrenal support, you could use some extra adrenaline, but I probably wouldn't go that way. I probably would just load them up more on like some Cataplex C or AC. And AC is also going to have some of that adrenal cytosol extract in there, which can be very, very beneficial. There's a few products that have adrenal cytosol extract in there. One is also Cataplex GTF. So maybe for that smoker that's got the blood sugar issues, GTF would help out.
Awesome. Thank you, Dr. Keppel.